Hi, this is Mohan from PostureIq. I'm here with Heather, and together we're going to show you 3 exercises that will help alleviate your lower back pain. I begin with a roll-up blanket or a beach towel, and I place it at the base of Heather's spine. I'd like you to lie back on the mat. And bring your arms as if they're extending overhead. Internally rotate your hands so your pinky fingers are facing one another. With a sense of extension, I want you to bring your arms back and towards the floor. Allow your hands to touch the floor. Beginning with your left leg, slide your heel down and then follow that with the right leg, sliding down, feeling the length of your body. Hook into the mat with your heels and attempt to pull your lower body down in that direction. At the same time, extending out through the arms so there's a sense of elongation. We can try this for 1 minute, eventually building up to a 5-minute capacity. It's very important that we put the blanket in place at the base of the lumbar spine where it meets the sacrum. It's encouraging an anterior pelvic tilt. A lot of back pain that we have is from compression. And when we sit for long periods of time, whether in work or watching TV or in our vehicles, our body slumps and we go into a posterior pelvic position. So this is a very gentle reminder of putting the pelvis where it could be to serve our purpose and to alleviate the compression in the lumbar spine. So when you're ready, Heather, I want you to bring your arms forward, one leg at a time, dragging it up, yes. And then bring the second one up towards you. Now we're going to move on to the second exercise. I'm going to invite you to lift your pelvis and move the blanket to the side. Place the yoga block between your knees and take a breath. Become aware of bringing your belly button to your spine. Gently squeezing your knees together to engage the yoga block. And as you do that, I want you to lift your pelvis from the floor into a bridge position. Place your hands on your glutes to make sure you feel them fully engaged. And gently allow your body to come back to the mat, relaxing your core. Take a breath. And we repeat the same pattern for a second time. The first thing is that we bring our belly button to the spine, towards the spine. We push the knees gently together on the yoga block. You can use a ball or use a rolled up blanket if necessary. And then we elevate the pelvis one more time again. I like to check to make sure that the glutes are being engaged. And then we allow the pelvis to go back towards the mat one more time. So this practice is done 3, 5, I'm working up to 10 times. So a third time, we bring the belly button back to the spine, gently pressing on the yoga block, lifting the pelvis up into a bridge position, hands go on the glutes, so you feel the fullness of that engagement, and then allowing the pelvis gently to come back to the mat. So Heather, you continue to do another 2, please, when you're ready. That engagement of the core, elevating the pelvis. It's very important that we engage the glutes. You'll notice in a lot of people's bodies as they get older, there's a tendency for these to atrophy. And when the glutes are not fully working in the fullness of their capacity, we have a tendency to use the hip flexors to drag our legs along. Really, in a body that's functioning, there needs to be a relationship between the gluteus maximus and the psoas. So there's an agonist and antagonistic function that supports mobilization, but a sense of empowerment when you step into the world as well. So now you can just take your block, put it to the side, and then you can gently either roll to the side and sit up. So for this third exercise, we will come to a standing position. I begin with my feet firmly on the ground. I take my hands and I place them on my hips. I gently begin to push down on my hips as I begin to elevate and lift my head as if it's going up towards the ceiling. I'm particularly focusing on my lumbar spine, that area that we often find to be compressed. My breathing is relaxed, and then what I'm doing is I'm going to tuck my belly button back towards my spine. And it's like as if there's a hook lifting my head upwards as I'm very gently pushing downwards with my hands on my hips. So what I'm doing now is I'm experiencing this length that's coming from the lumbar spine, expressing itself up into the thoracic spine and then eventually up into the cervical. But for this very moment, I'm focusing more on the lumbar. I'm now going to close my eyes and visualize a space existing between the vertebrae. So there's more space and breathing room for the discs, so they can begin to repair themselves. So visualization is a very, very important aspect of these exercises. Again, I'm tucking my belly button back towards my spine and lengthening. And I can feel that unwinding taking place. We need to be patient because we might have 30, 40, even 50 years of practicing compression through sitting for long periods of time in our vehicles, on couches or in office chairs. If at first you find it difficult to experience that release, then I would do this for about 5 breaths. I gently allow my arms to fall away. I take my thumbs, I bring them behind my head, and we have this shelf called the occipital ridge. Everybody has one at the back of their head. It's usually on the hairline. I put my thumbs at the edges, and then I begin to lift my cervical spine, my neck, I elongate it. I tuck my chin back, and I bring my head up towards the ceiling. So now I'm continuing this lovely elongation that I began in the lumbar spine up to the thoracic and cervical. And once again, I begin to tuck my belly button back towards my spine as I elongate. And I would do this for about 1 minute. And then when I'm ready, I allow the arms to fall away, but I retain that sense of length in my body. So as if my feet are on the floor, I'm connected and grounded, but also as if that hook is holding me up. So I have a sense of buoyancy, like a balloon. And now I take that into movement. So I retain my sense of length as I move, as I step forward and back. Very important that we retrain ourselves, because we have trained ourselves into a deep type of compression. And that creates havoc, because at the end of that spine, the lumbar spine, is where you have compression from the spine meeting support in the sacrum. The two of them need to have a good relationship. A poor relationship between compression and support leads to dysfunction, and that leads to pain in the lumbar spine. So hopefully these 3 exercises, that you will embrace them and they will help to alleviate your low back pain. Thank you so much for watching.